There we go. Hello, hello, hello.
Greetings, everyone. Good morning, good afternoon, depending on your time zone. We're so happy to have you with us today for part 2 with Tiffany Mensah, Bridging Divide, where systems meet for youth and family wellness success. This is, we're going to focus today on programs that connect the evolution. So really excited. I've put something in the chat. Please introduce yourself. We're going to have a really engaging chat discussions today and lots of back and forth with our presenter, Tiffany, which if you participated last week, you are aware of. We got great feedback. We'll talk about that a little more and we'll go ahead and get started. Next slide, please. Just run through a quick disclaimer with you all. And this presentation was prepared for NTAC under a cooperative agreement from the U.S. Department of Health and Human Services. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may not be reproduced or copied without permission from HHS or the authors. That's us. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from NTAC. This event is supported by HHS as part of a financial assistance award over 5 years with 100% funding from SAMHSA or from HHS. The contents are those of the author and do not necessarily represent the official views of, nor an endorsement by HHS or the US government. If you know NTAC, you know that we are a consortium of 7 different highly engaging and dynamic organizations, including CARS, the Texas Institute for Excellence in Mental Health, FREDLA, Youth Move National, Change Matrix, the Thrive Center at Georgetown for Children, Families, and Communities, the American Academy of Pediatrics, and MedStar Georgetown University Hospital. Please visit our website, intactmentalhealth.org, for lots of updates and new podcasts and all kinds of information that we would love to share with you. All of our services and resources are free to engage in and access. And again, thank you for joining us. Look for a follow-up email. If you need a certificate of completion for this event, please email Bridget Okayu. And yes, you will get a copy of this presentation. We will post it in the chat as well as email it out. And this will be recorded, the session, as you all know, and available on our YouTube channel, along with all of our other recorded sessions. And now I am super excited to reintroduce Tiffany Mensah, an advocate, consultant, and speaker with D.O.V.E.S Network, who is going to take it away from here. Thanks, Tiffany.
No problem. Thank you for the introduction. Good afternoon, everyone. Good morning. Depending on where you are, I'm in Arizona, so sunny greetings, warm greetings. We have already tipped into triple digits out here. So I'm grateful to see everybody that's signing in the chat. If you are a first time or just drop first time in the chat, and if you're a repeater, just put 2 times in there. I just want to see and kind of gauge the room, how many repeaters we have in versus first time. Okay, cool. Okay, all right, awesome. I see a blend of both. Welcome back to those I got to meet last week. Thank you all so much for your feedback. I definitely designed, point intended, this webinar with your feedback in mind as well. So I appreciate you all taking the time to give that really great feedback. So today we are definitely going to jump right on in. We are very interactive. If this is your first time here, I want to welcome you. With the time that we have, I get a lot of feedback as it pertains to diving deeper into the program. So we're going to do that this week. But one of the things I also want to tell you is lock in. Use this time to clear war on the disruptions and the notifications and all the things, because we go through a lot of information in this little bit of time, but I definitely hope it is a strong value add to your day and your spaces. I am Tiffany Mensah. I am the founder and executive director of D.O.V.E.S Network. D.O.V.E.S is an acronym that stands for Daily Overcoming Violence and Embrace Safety. We help teams and families heal from the impact and exposure of domestic violence and sexual assault. And one of the things, when you look back of like, how did I get into this? I spent nearly 2 decades in corporate America, Fortune 500 companies from Domino's Corporate, Allstate Insurance, Rocket Mortgage. But one of the things that trailed me into my corporate journey was that I grew up in a home of domestic violence, and I had no idea the impact of that. Would trail me all the way into adulthood before I ended up going and starting to really do the deep dive work of counseling. And that's where I saw the biggest results. So as I'm making my way, my plan is like climbing the corporate ladder, I started seeing that there was a gap. I started seeing that it wasn't just me. A lot of the ACEs work that came out, a lot of the hearing more the increase of domestic violence numbers, and just being that heart of empathy of what happens to the kids. And I started seeing that there was a perspective on systems and efficiencies that was needed to help this generation heal. And so as I started seeing more and more teens falling through the cracks, I designed the organization that's before you today. And so last week I kind of shared a lot of the stats on why. And then today we're going to take a little bit of how I did that. And hopefully, as you all are seeing the state of our youth right now in the spaces and sectors that you're in. So you all know that pivot quickly, right? That's one of the things we talked about last week. For youth sakes, we have to pivot quickly. And now, with pivoting quickly, and we laid the foundation of the importance of the why. Now we're going to talk about, okay, so how do we pivot quickly? What does those programs look like? How do we make that connect for today, with resources, with finances, right? With all the things. How can we do that? Spoiler alert, we're stronger together. And a lot of the ways and bridges we've been able to make an impact with D.O.V.E.S Network is through building those bridges with those that's in our community. We turned 5 in April, and grateful we've been able to make strides. So this week we're going to talk about that, and then we'll give you a little bit of breather room. So I want you, if you haven't already, still protect this time. Act like you're still coming to the webinar. Block this time off on your calendar, because if you missed the first one, if you are trying to catch up from even the first one and this one, put it together. Use that time to actually write out and start plan. Maybe have a team huddle, have some meetings to actually take this information and apply it. Because information without application is just information. The power is in the activating of it and applying it. So then we'll come back together on June 11th for sustainability and in uncertainty. So there's a lot of things going on when it comes to funding in all of the sectors. So okay, we are seeing, all right, today's journey. So we're going to kind of go through, like I said, the execution implementation part of that. So foundation review. For those that are here for a first time, I'm going to very quickly go through the foundation and the why. We're not going to spend too much time there because we have a lot of content to get through. But we're going to talk about programming by design. We're going to talk about what the integrated service model design looks like and the components of it. And we are going to talk about measurement and accountability. Uh-oh, that A word, accountability. Yes. All right. So what brought you to register? I told last time, I like very much interaction in the chat, because here's the thing. While I read your surveys, there was so much feedback that everyone liked. A lot of folks, I'll say 90%, liked the chat engagement. There were some opportunities. And last week I told you all, hey, I am very interactive and I need you to talk back to me, because we are virtual. If we were in a room, I would just come to your table. Since we're not, I'm interacting with you in the chat. So I want to know what brought you to register for this webinar. What is it about programs that connect that you're looking to get out of it? Because that helps me with making sure we're tracking in the right direction. If I need to make some pivots, I can definitely be able to do that. But I also want to put the note as well. Once we start diving into programs that design, right? I'm using my organization as an example, as a model, but I want you to look at yours. Insert yours here, insert your space here, because there's so many different spaces and sectors from I saw even just from the data last week that, hey, how are we? How do I apply it? Let me take this lens and then put this onto where I'm at to see what we can do and what are the learnings there, right? So I'm thankful to see that it's a lot of aspects in here, constantly improving upon services to youth. Yep, yep, yep. All right, cool. Okay, so from a foundation review, and so I'm going to read those as you will have a poll. But also, if you have questions, we did not talk about that last week. And we also talked about too, when you poll, the best way to get feedback on your programs and your services and your offerings, talk to your audience directly. That has been a gold mine in our organization, is hearing from the teens and the families directly. And even if there's opportunity feedback, right? That all goes to working towards the greater good. So I am also modeling that by looking at your survey results. And so a lot of that was I didn't get to ask questions. So make sure at the bottom of your Zoom bar, you click on Q&A, drop those questions in as they come. And so if there is a middle of like a poll, or if there is time at the end, hopefully there's time. I'm gonna try to slow it down from the feedback too. Then we're gonna address it, but make sure we get those captured, because another thing that we're also working on is if I don't get to it in here, I will still get you those answers. All right. So make sure you're using that Q&A at the bottom of your Zoom toolbar, okay? And we have our tech support that can also help you as well if you are unable to do it. All right, let's dive on in. So the foundation review, we started with what the impact of system fragmentation, right? So when we look at our target audience and we look at these are the groups that we're trying to talk to when we talk about youth, we looked at the stats. 1 in 6 U.S. children in the United States between the ages of 6 and 17 has a treatable mental health disorder, right? When you look at the aspect of, hey, there's a delay, there's about an 8 to 10 year delay between when they actually get the services they need. And the impact of that is fragmentation. So for the youth, you see there's repeated assessments, a lot of storytelling. There's contradictory treatment recommendations depending on the different audience that teen goes to, disruption of their education and development, and there's just loss of hope in helping in the systems. But then for family, the burden is something that I've witnessed firsthand. I've witnessed both of them firsthand. But parents have to take off time. They have to navigate that burden. They're taking time off from work from other children. There's the financial component. There's emotional exhaustion. And what happens is that we aren't seeing the impact of which we're here. We're here to support. Why aren't they coming through the doors? Right? And the cost of that disconnection for the families, and this is verbatim from when we talk to youth, I'm tired of telling my story over and over. No one's talking to each other. A lot of times we think that the teens and kids, I know when I was growing up, I heard it a lot, like, oh, they don't know. They don't know. Let me see. I'm not sure. Not sure how I can get the annotation lines off of here. Yeah, not sure how I can do that. But they're saying, we're not sure how, what if they can see it or if they notice it, like, oh, they'll be okay. This generation is noticing younger and younger and younger if things aren't connected, if things aren't organized. I'm working on a teen event in my city right now. And when we started the initial work, the groundwork of what they wanted and what they were seeing and what hasn't worked, the first thing they said is when they have events in the city currently and they're not organized, they are noticing. Yeah, absolutely. They are brilliant, Michelle. They are. So when they can tell right off back, if you're trying to help them and it's the disconnect, they're calling it out. Everyone's giving different advice. So they're picking up on themes and patterns pretty quickly. All right. Pretty quickly. So one of the things that for families are starting to feel like they need to be able to, they feel like a full-time case manager, right? They feel like they are able, like, I got to bury this load. Like, I'm just trying to heal, right? Using my space of helping domestic violence survivors and their children. the teen specifically, it's enough. I'm trying to manage the behavioral. Now I'm trying to manage all the different aspects of from intake at school, from this mental health organization, from this doctor's office to this paperwork. Like, calculate that time. They're giving up just trying to get help, right? And they don't know who to trust anymore because it's so fragmented. This is the human connection, right? Of the fragmentation. And if the human experience isn't enough, we talked about the cost of disconnection. If the human experience isn't enough, then here's the financial aspect, which is it's costing $93 billion to the United States economy, right? Disconnected youth cost $93 billion per year in lost revenue. And there's redundant assessments. They're taking 4+ intake assessments, depending on the organization they're going to, the long-term costs that are associated with it. If they drop out, again, it's if they don't get the help they need, and then they're showing a lot of behavioral within the school settings, school puts them out, then they're dropping out, then that's a $292,000 at that. Like, it adds up, right? From a human experience perspective and financial perspective. But the benefits of it is that these numbers, based on a program evaluation, is that you will get an increase in school outcomes. You will get an increase in crisis service utilization. You will get an increase when this is done right. Here's all of the benefits of what this looks like. So we went over that last week. And then we went over the core elements of the successful collaboration with those that's in our communities, right? So you want to have a shared vision and goals. You want to make sure you have clear roles and responsibility. You want to have those communication protocols. You want to have the resource sharing agreements. What does this look like? We want to have data informed decision makings. And above all, we want to definitely make sure youth and family is partnered in this. We have their voice, we have their feedback, we know what they want, and we remember our why. We cannot get lost into majoring in the minors that we forget the minors of the families, the major of the family, right? So again, I know I'm going through this foundation a little bit fast, but please go back and watch the recording to last week so that we make room for what's coming up ahead. So sector mapping considerations. This was, if I'm looking to, I'm not an expert, or we're looking for like a quick solution to be able to maximize our youth programs and impact. Here's some considerations of, like, if I'm going to connect with another organization in my city, in our sphere, where should I go first, right? You want to check out mental health services. Who are the mental health services? Vet each one out, right? Educational supports, primary health care, faith communities, recreation programs, family support services. Who's in your, I'm dating myself, who's in your Rolodex, who's in your community Rolodex that you are able to connect to. And we're going to go specifically into what that looks like and how you can kind of even get over that, because one of the feedbacks I saw in the chat last week was like, schools are a really big barrier. So I have an example to even talk with you as well. So our first poll, we're going to talk about implementation readiness, right? I want to kind of see and kind of gauge the room. Implementation research. I saw there's a couple of researchers here. Thank you for joining. Is that a couple of research shows when it comes to implementation that meeting people at their readiness level increases success by 60%. But knowing where you are across these different levels also is like, there's a power in seeing that and being able to say, yep, this is where we're at. And then we can kind of try to tailor it accordingly. So I'm going to give you a couple seconds to be able to complete that based on the attendees in the room. All right, it looks like resource availability is huge, which this is perfect, because a lot of what we're talking about is going to show you how to get those resources within the community. All right. And then second one is partnership potential. Okay, cool. Once the poll ends, I have another question for you. So I told you, if you're new to the chat, if not new to the chat, if you're new to the webinar, welcome, welcome, welcome. I am very interactive because what Jennifer is not seeing the poll, guys. I think our team is going to be able to get that for you, Jennifer, for you to be able to see it. I'm seeing the results come in. So I'm seeing resource availability. I'm seeing partnership potential, and I'm seeing organizational support. Okay. Got it. Got it. Got it. Got it. All right. We can take the poll down. Oh yeah, you might want to check your pop-up blockers and see if that's a causing a concern for it, why you're not seeing it. And then urgency, I see that implementation. The readiness is there's an urgency there. Okay. And then questions about what about the cultural relevance of the resources? Okay. Got it. Awesome. All right. So we can end the poll. Thank you, team. And the next question we can all see amongst the room. The next one is, all right, in the chat, I know we're all in the business of data, we're in the business of stats, but I have to ask you, when was the last time, based on your organization, based off of what you do, when was the last time you looked at the data based on your program, like survey feedback and like assessing the neighborhood needs assessment? When's the last time you looked at that data and how quickly did you act on it? And let's see what we got here. Okay, monthly, 5 days ago. Great. Okay, this is awesome. Awesome. Weekly, last month. That's awesome. Perfect. Love it. Love it, love it, love it. So now with that, with that aspect, the second poll is when it comes to the current programs and youth and families, how would you rate that? How would you rate the effectiveness of your current program? How would you rate? And there should be a new poll that's up. How would you rate it? I want to see. Okay. I'm seeing a close tie between somewhat effective and mixed. Yeah. Okay. Weekly during team. Highly rated. Okay. Okay. Perfect. Yeah, between somewhat and mixed is there. All right, great. And so with you looking at the data, we'll go into using some examples of of how I've used the data. So with that, as you guys are doing that, finishing that up, I can talk to, I know I see it's a couple seconds left on there, my approach. So when I started Doves Network, when I started this organization, I'm like, I have a curriculum, I have an evidence-based curriculum because I went through this, like I know what they need. I see the need. I have the stats. All right, cool. And the first area I was like, I want to help them right away. I want to help the teens right away, right? We're going to do peer support groups. That's what we're going to do. And we ended up getting our teens. We started right smack dab in the middle of the pandemic and like April, like 1 month. And what was happening during that time? Stay at home orders were up. They were having a front row seat to what was going on. So when we saw that, when we asked them, all right, mixed. Okay, so mixed is at the top spot, somewhat effective and highly effective. Okay, cool. So when we asked them about, hey, you know, is this effective? Like we could instantly see there was like forced compliance. We never want that. And my background is a lot in marketing, right? So marketing, especially when you're working for these bigger organizations, you do nothing without the numbers telling the story. So I instantly did a focus group with them and they're like, this feels like school. This feels like work. This feels like work. So I had an idea, the reality hit, but they weren't buying into it. The audience that I want them to buy in wasn't bought in. So then I started asking them even more questions because I'm connected to the community. Well, the community is sharing the same concerns. The teens aren't connected. Why aren't you connected? It feels too therapeutic. They keep laptops in front of my face and they're just typing. They're not listening to me. They're not communicating with me. They're talking more to me as I'm a problem, like the human level, right? Hearing all the different aspects of it. And what I learned is that it's not just one pathway, it's three pathways. So with D.O.V.E.S Network, we help families heal from the impact and exposure of domestic violence through intervention, prevention, and empowerment. So we learned that the journey of, when you think about the acronym of what D.O.V.E.S means, daily overcoming violence and embracing safety, that's a daily decision. So what are those journey points that they need to help overcome violence and embrace safety? Well, first, and you'll see this, I started it at intervention. But the stats and the data was telling me that no. It's not you. We got to get ahead of it. We got to get in front of it. So we got to get prevention. So from there, we need to help them understand why this is a problem first. So even with intervention and prevention, it can kind of go both ways. What we were seeing in my sector was that domestic violence is happening amongst teens at a very high number. So what's not getting addressed at home is now coming into the schools, in the relationships, in the adolescents, right? And so with that, they are, yep, Michelle, you're correct, the equity lens of it. So when we see that, we're like, how do you want to, what are the things they're listening to? What are the things that they're consuming media in? What are the things that are buying them in? How do I not change my whole design? But all right, let me come in, help you understand why it's a problem without helping you see it's a problem. So here's prevention, right? Let me just point some nuggets to you. Then so from the prevention lens, we do the educational awareness initiatives. We partner with those in the community that help us from a prevention perspective. We help those, we come alongside of those that are in the schools, right? We come along the doctor's offices, etc. Now, from there, even if you're not in it, it casts a wider net. So even if you're not in it, you at least are aware and you can be a change agent. You're equipped. But if you're in it, now you know where to go for help. So now we have the intervention model where we have our peer support groups. And then that helps to us not just respond to crises, but to help prevent them and rebuild resistance. So now we've designed how we connect to them when we're directly intervening and helping plant seeds of healing their way, their terms. Then we go into empowerment, because on the other end of that, this is cool that I can help, that I can heal, but my mom is struggling to pay the light bill, or my mom is still being dragged in court, or insert parent here, father, insert parent here. They're going back and forth in court and don't have the resources. But we, as D.O.V.E.S Network, we are connected from a state level to know where all the resources are. We have a warm referral intake that's vetted and safe, where you don't have to keep spinning your wheels. We are actually built the connections and the partnerships to say, hey, hold on one second. I have Miss Karen with XYZ organization here. I'm going to pass you here. So now it's a holistic community and continuous support cycle. That is how we took our data, because it wasn't working. Again, had the idea was here. It was not. So we had to create this 3-pathway model based on their journey and their touch points, and also addressing a part of these touch points, what is going to keep them away. To have this program architecture that has like, all right, this is what the inputs and outputs should be. This is what the activities should be. This is what the outcomes should be. And it can be very structured for us, but for the youth, all right, now how do we translate it to them to bring them in, right? Because this model has truly emerged from the youth development. One of the things that I tell a lot of my peers in this space is that we gotta have the teen's voice. You gotta have the family's voice in that, and build in that time to actually be able to address it. So I'm glad you all are being able, like, grabbing data every week and looking at it. Have you built in the buffer time to also build a queue of continuous improvement? So we're going to talk about that. So when we talk about the building a continuous care network, right? So year one, I told you we're 5 years old. Year one and year two was truly about proving the concepts. Does this work? Right? Because the studies have shown that 70% of new collaborations fail within the first couple months, right? So we're going to start small. We're going to try to take solid foundational approach, rather trying to connect to everyone immediately. And especially with organizations, because what everyone does is impacting lives. We cannot do more harm. So I understand that now it's not a blanket call to like, let me go grab you, let's partner together. No, 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 no. There's the vetting, right? So we started with one organization improving that concept. That went well, right? We had a lot of those aspects of like, okay, we have a mental health provider and we have a youth programming provider here. Okay, perfect. This is what this looks like. We're about to get into the dynamics of what that looks like in the next section if here. But that works. Then we move to the next one, right? We expand it a little bit more. Let's pull in some more community. We pulled in some faith partners. We pulled in the police departments because the survivors are coming to there. So let's have this pathway. Okay, let's pivot and redesign. We did our pivot and redesign in year 3 because we were hearing from the youth like, hey, this isn't all right, pivot and redesign. And then we implement it in year 4. And now that we've crossed over year 5, we definitely have solid partnerships. We have a model that is sustainable. We have this able to replicate. We're seeing other organizations starting to replicate that, right? So when we look at provider integrations, again, our referral pathway builds in each one of these areas. And why is that important? Because we can only service one. We are in the business of our target audience, right? We have so many hours in the day, we have so much budget, we have so much staffing, right? But here's also the providers they interact with the most. And probably 9 times out of 10, they're going to talk to you about one of these providers on their way there or the need. So here's how you can build it in. We knew out the gate, though I'm a certified trauma support specialist, we have trauma informed care, we have trauma training for all of the volunteers. We're not mental health therapists. Right? So I knew out the gate, that's the first organization I needed. And that's the first partnership that branched off and kicked off beautifully, right? Next is building the trust with the community service, social service agencies, right? D.C.S, Department of Child Safety, the other domestic violence shelters and organizations, right? Building up that Rolodex, the schools. What are the schools? What are they seeing? How can we be a solution to them? Same for the faith communities, right? For domestic violence survivors, 44% of them still cling to their faith. So it is imperative that these churches be trained, that you have to know who to go to in the community should a survivor disclose and how to keep their safety intact, right? City government. A lot of when talking to the chief of police out in the city that I'm in, he said there isn't a diversion program. We're working on that diversion program now because the kids aren't bad kids. But when there is boredom, when there is no positive coping skills to help them heal what they're seeing, then that's when you see those risks come up. But we can build something together. So you have these organizations that are locking arms of like, yep, I have this problem. You can help here. Where it's back and forth. It's not just a complete handoff in some instances, but it is a back and forth arrow. And then, of course, the youth organizations that see them. So with that, our aspect of the first interaction, we're gonna have it problem solving because that's one of the feedback I got in the survey is like share one of the biggest. I want you all, and I'm gonna put some music on it in the chat. I want you to share one of the biggest partnership barriers you faced when trying to establish partnerships. Here's the thing though, once you list yours, I want someone else who, if you've experienced that partnership barrier, I want you to share what you think might work to overcome it. How can you help them overcome it? Like, oh, yeah, we went through that because also saw in the survey, wanted other networking opportunities to be able to help others, right? And help the peers, others that's in the spaces that you're in. So if you can drop in the chat, right, what you feel the biggest barrier is that you face trying to establish. And if there's some, I think it was like 14% or 16% that have highly effective programs or collaboration. If you like, oh, this is how we got over that, please drop your ideas on someone else's so that we are stronger together. We can start building this up right now. And I don't want you to feel like you're taking a test. And I'm not going to stay too long on this. So play some music, but I'm gonna see if we get some collaboration going within here. And some that I will see as you all are dropping in the chat, I'll drop in and help as well, is that right off the gate, lack of motivation to change, right? One of the biggest partnership barriers when trying to establish lack of motivation to change. If not, here's a couple of quick, if you see the lack of motivation to change, how can you, based on the space that they're in, you may have to show them out the gate, hey, if there's no change, here's the situation, here's the context. If there's no change, this happens. Put all of the negative that's going to happen, because without change, the only constant is change. So if you can outline, here's all the things that are going to happen if this doesn't change, but also have those solutions of, all right, but if you change, this will do this. So I hope that's a good nugget for you. People don't think they can share information at first. All right, so with that one, how can you develop the trust? That one, and we're going to talk about it. That's going to take some relationship building. When people think that at first, then it's not a pitch of, here's how I can do, and here's how my organization can help you. It is let's get to build relationship, learn about what's going on here, common conversation to help develop that trust, and then allow it to be. It goes right into the next one. Funding. Funding that's where this cross collaboration will help in some instances, right? Because with the funding barrier, the funding is not going to ever go away. I'm a certified program and project manager. And one of the things when I would lead a team of project managers, when we asked them, what do you need? They would always say, more project managers. We need to hire, we need staff. And so I knew what the budgets look like. And so it would be a conversation of, hey, listen, help isn't coming, right? So if help isn't coming, then how do you innovatively think about how you can handle this project load, right? So when you think about funding, if the funding doesn't come, what are some other ways you can develop and get funding? How can you get sponsorship? What are the different areas that you're able to be able to get that, right? So with that, different venues and visions, we're going to talk about all of that. So those are a couple of the tips. And I'm glad to see that there's some collaboration going on. Great job. Love it. We'll deal with a little bit more. Okay. So with overcoming early obstacles, right? A lot of what you put in the chat, I'm glad I kind of prepared for. So one of the ones that I've heard a lot has been the no time for meetings, right? I mean, time isn't anything new. This challenge isn't new. It's not new. But instead of creating new time or adding new time, they won't make time for me to meet with them, or I can't talk to them, or I can't have virtual coffee. What do I do? Where are they at? Look at their events. Look at what they are doing. Like if they have an open house, or if they have a conference, or if they are having a network meeting, if there's a networking meeting and they're there, right? What are those things that you can pop up as well to just show support as a community advocate, right? And then with that aspect of okay, the patterns is another one, right? Identifying patterns and what's in it for me. That's going to always be what's in it for me. So if you only have one shot to take, to get connected with them, what are the patterns that you're seeing that's connected to that space you're trying to collaborate with and talk to? Hey, my target audience can really benefit because of XYZ, right? You may have to do a little bit of homework, but I can definitely tell you AI will help you on that aspect, run a little bit faster from that component of hey, here's the patterns that I'm seeing even amongst our community. And this is what I see from the what's in it for me, how your collaboration will solve it. Instantly, I'm not even going to waste time. If I know that you're not even going to make time or etc., I'm going to hit you with, I already see this pattern. I already see this benefit of how we can solve this problem, right? The next aspect is not setting clear communications, overcoming that obstacle. Don't dance around it. Here's the expectation up front, right? We're not going to have here's black and white, and then there's shades of gray. We're not going to play in the shades of gray. Here's the expectations up front and documented. I'm not, I wouldn't say at least 95% of the time when I talk to organizations, when I talk about, all right, well, we're going to go ahead and document that, and then we just map out an MOU. Those that are not serious are going to back away. But those that appreciate the structure and expectations are like, I want to do business with you. I want to collaborate with you. Yes, let's do this. Right. So when it shows that you're already coming and you already got these things thought out where they don't even have to, that's going to decrease barrier to entry. Resistance. Before you even go into it, list the resistance points up front. Right? Here's all the things. Because again, if I've already outlined, like resistance is predictable, but it's also manageable, right? When again, working with large organizations, change management is in the back pocket. So if you're worried about confidentiality and liability, then hey, right up front to establish trust. If we get together, I already know we should do joint trainings with our legal counsel, have the clear protocols written out. We're going to have here's the immediate escalation process, right? To lower what that resistance to the communication and the collaboration would look like. And then of course, different organizational clash, right? Like your organization might have language. That's where you go look at the first webinar, because I talked about the language jargon and how it develop what the shared language is. Develop if here's a translation or an acronym kit, right? How do we talk the same language? We different language because of our organizations, but to the client, this is going to be what we talk through, and this is how we're going to be able to move ahead so that language isn't even a barrier. And then no follow up. Y'all, I hear about no follow up a lot, right? So you reach out, they don't follow up. But have you tried all the different methods that if they didn't respond back to an email? Did we also try calling? Did we also send a LinkedIn DM? Did we also deliver donuts? Especially if we're talking about collaborating with those that's in our spaces, just a pop in of like, hey, I appreciate the work you're doing, right? Those type of aspects. So now we're going to get into programming by design. So now we've talked about a lot of from a foundation review perspective and kind of looked at how we did it, because a continuous care model, it doesn't happen overnight, right? It has evolved through trial and error. It is consistent relationship building, relationship equity. A lot of how you move further faster is the relationship equity and the commitment to putting the youth above organizational convenience is the hack. So with that, we go into insert your organization here. We're going to do a deep dive. This is where I want you to start thinking through that lens, right? So the first couple of months, just to set an expectation, right? Hold on one. I have a husky who's trying to say hi. Um, right up front, foundation building is going to take the most time, right? As you were talking about bringing in new relationships or even looking at re-bringing on new relationships as you evolve, even if you're highly effective, right? You're going to take a couple of months to focus on what is those initial needs assessments. Based on these initial needs assessments, you're looking at your data right now, but have you thought about the who for the partner identification of who can help? Who is in the community that you know that you may need to have some additional conversations to bring them into if you haven't already? And then what do those agreements even look like, right? This is the foundation in which all else, once you do this heavy lifting, it should be pretty much rinse and repeat from there. And then you get into the communication rhythms and then implementation. So last week, when we talked about the partner identification aspect is not just making lists, it's literally like a network analysis. And so I included it in here as a recap because we have to spend equal time understanding power structures and the relationship dynamics. So if you say here's your organization, here's all of the different sub organizations in your communities, here's what they offer, here's what they have to bring in, here's their entry, right? Mapping that out and kind of bringing big picture vision is key. Cat, sorry. So with that, You look at this list and it's an intensive list. I'm a whiteboard nerd. I have whiteboard walls in my office, no exaggeration, like wallpaper whiteboards, because this is a type of think work that goes into it. And for my researchers, you may love that's on the call, you may love this activity. So being able to map out the stakeholders within the community based on your needs assessment, right? These are the core five elements, right? And so when I talk about um agreement and communication, it nothing clarifies like clarity. Brene Brown talks about clear is kind, right? The foundation building is 80% of relationship work. It's less about paperwork, but more about the relationship, right? So if I can get this needs assessment, I can validate, all right, here's the gaps, here's the opportunities, what we're seeing with our audience right here. With that, here's I feel will be a great fit from a partner identification based on that stakeholder mapping. List those things out, list those barriers. And then if you can do a warm transfer and a connection, right? How can you all come together? Maybe if that's even an event where everybody is their own different aspect, but we come together and collaborate, we can do that, and outlining what that agreement looks like and the communication rhythms. Because again, this may feel like, no, I don't have 3 months to put to this. Who can dedicate 3 months? Because again, the way the youth of this generation is operating, it requires this new level of think work. Old systems and old playbooks aren't working. But I'm telling you, the investment will pay off because it's building trust. So then once you have that done, then you go into piloting the idea, right? Start small. Because I worked a lot marketing, I worked a lot in product management, product development. Every time a product goes, they have is this little window where like we're just gonna pilot and get some quick learnings, right? This may take you probably another maybe 4 to 9 months, depending on what you want to pilot to get really good data. But you can have many pilots within that window. But you can start small, you can have the different levels of, all right, the feedback is giving this. This is your A/B testing. If I say it this way, how are they coming in? If I say it this way, how are they interacting, right? This is going to confirm that research, and that data is going to come in at different levels of like, maybe you wanted to change your programs. Maybe you wanted to try this concept of like, I want to make it more effective and try this idea. What does that pilot look like, right? A pilot is also a low barrier to entry to even also see if we are going to be a good fit for each other. Like we're like when you think about an interview, HR interview, we're testing to see if we're good fits for each other, honestly. So this would be a good proof of point for the broader adoption, right? You may not want to start big. So dedicate a time for testing to get those learnings. And one of the things that I say too, I know that we want to get it perfect. We want to get it right. I tell my teams this as well. It's okay to fail fast. Fail fast. What are even the learnings of that? How do you make it better? Right? Develop the processes and the protocols from what you've learned. Test those referral pathways. Document the lessons learned, right? Document what that looks like, right? Because, for example, if I go back to and I take you through, let me go back to this foundation building, right? Let me start back here. We talked to a school because I saw there was a lot of last week, a lot of like, I can't get into schools in the chat. The school that we have a partnership with, we went to them, I'm gonna say year three. Year three, we went to them what we had. They're like, yeah, we not a priority right now, right? We got called back after like a couple years. We got called back, not now, but now is the right time. We are seeing needs assessment. We're seeing that a lot of our middle school boys are getting in trouble with anger. We don't want to punish them. We don't want to punish them. They know, and the school knows intimately what these households are, right? So that we don't want to punish them. But we're having to put them in detention. We want a different way. All right, they called me, partner identification. So then we design an agreement. Here's the curriculum we offer. We can come in either after school program, during lunch program, and this is what we can offer. The school said, We actually don't want that. We want you to come in and do programming during 2 o'clock to 3 o'clock every Thursday around this time for all of the middle school boys. Okay, what are our communication patterns look like? When will we meet? When will we talk? What does implementation and program delivery look like? Right? So we built that. So then I said, let's pilot. Let's see. Let's see how this works because teens is our focus. We didn't necessarily have middle schoolers under that focus yet. So this is even a pilot on our organization where my board is like, let's see, because when we talk about prevention, this may be this is secondary audience, right? So we're going to pilot it out. So we piloted out the curriculum for a shorter amount of time in this window. And through that, we were able to see, oh, this works. This works. So now this pilot, the school partnership, the parent feedback, the middle school the boys feedback, the community partners feedback. This has become our best advocate for expansion because we piloted just to confirm we knew it would work, right? But the pilot partnership determines everything that follows, right? So you want to pilot your selection criteria based off of the organizational readiness, right? How are they going to champion the presence? How are they going to manage scope and the measurement capability? So when we looked at the pilot selection, we said, all right, organizational readiness. They are ready. They're ready because they're like, we don't have to do lesson plans. We don't have to do curriculum delivery. Boom. We are going to support you full on. Let's go. Awesome. They're going to champion the presence. They said, hey, we're going to do a marketing push. We're going to do a video campaign. We're going to push you on socials. We're going to document these learnings. Cool. Manageable scope. We said for 11 weeks, we're going to do this during this time, right? These are the deliverables. We're not going to roll out a whole bunch of, we're going to come in, deliver. They're like, we will support you every single week. And measurement, we had pre and post surveys. We had direct activities within the programming so we could get the feedback from the middle schoolers as well. And we were able to present out to the board halfway through the pilot, here's early learnings, right? It's already showing this is breaking down any type of barriers, any type of concerns for their board and our boards. This is a highest predictor of scaling success. Then, and again, if you have questions, don't hesitate to drop it in the Q&A. So then there's the feedback loop. Continuous improvement isn't optional. You have to adjust based on the data, not assumptions. So when you have that, you have this collection method, right? Understanding the market trends and the client insights, right? Then with how are you collecting it? Then the review period, we're going to factor time. We're going to schedule time. The calendar, if you don't control it, it will get away from you. And I don't know how many will agree with me on that one, but I have seen it happen way too much. That if I'm not able to control my calendar, it is going to run away. So I declare, this is what I'm putting review period time on my calendar. Okay. And then we're going to get to execution. All right, I've reviewed it. If this is a consistent cycle, if it's a consistent roadmap and it's embedded into the DNA, then I'm going to always be looking at it. I'm going to always have these surveys go out. I'm going to always adjust and repivot, right? The strategy, right? We're going to analyze these outcomes. We're going to adjust the processes that we can, even if it's just a little tweak. Right? Even if it's just a little tweak. And then we can expand on of like, what does that look like next? Here's the strategy. It's continuous. It's a continuous loop. And one tool that I also want to give you too is Plan, Do, Study, Act, PDSA. Right? PDSA. I don't know. Kimberly, are you looking ahead of the slides? I don't know. But the PDSA, right? It is definitely one of those quality improvement methods that help you be able to see this. Yep. Yeah, okay. There you go. So Kimberly is tracking. So like the first stage, you're planning. I'm planning. This is what I want to see. This is what I want to do, right? It begins on identifying that goal. And then the next stage is that small scale implementation. The small scale. Again, a lot of times we get overwhelmed at just the thought of doing a whole different program by design. because we're thinking about the magnitude, and the magnitude is great. Think big. We want to think big. We want to go after big, but small is underrated. So if I start small, then we can move up in here. What are the incremental points of that, right? And so study how that is coming along, and then act and do, right? The study stage is looking at the data outcomes. It's achieve of how do we achieve this, right? And then we have a clearly executed plan because we've built it up. All right. So with that, we then go into, all right, systematic integration. From this, right, how we're going to build it out. Now that we've gotten the feedback, now that we've tested it, now that we know it's validated, now that we have the continuous feedback loop, we are going to document everything that works. It now needs to go into policy development. It needs to go into formalization from a process perspective. We need to start training. What does the training components look like, right? Integration requires that four-dimensional thinking, the policies that we have, the policies and processes, how we move, how we flow, how we work, right? That integration, the shared competencies component, right? How are we going to, what is the data? What matters to us? And of course, financial impact. What is the cost analysis that also rolls into this? We're not going to get away from cost ever, but we can know what this is going to mean, even if it's positive, even if it's negative, right? And ultimately, from a sustainability, right? We have to think sustainability. And if we've gotten away from thinking about sustainability, it doesn't just start on it start like down the line. It starts day one, not year three. Sustainability has to be built into the DNA. It has to be built into the DNA. And that's where it's like, okay, as we think about these newer programs, a lot of times there are organizations that I've worked with, there's organizations I've talked with that have been around a very, very, very long time. And for the first time, because society has changed so much, it starts thinking about sustainability later versus up front. And then that's how you get into the stale content. That's how you get into stale programs, because how do we evolve? How do we change? And I intentionally have main point here, because that's meant for you to think through, right? So you at least like, okay, from growth partners, from youth perspective, from outcomes, like what are the trends pointing to, not just in 2025 and 2028, like, right? How do we build up to, how are we in front, not behind, right? We want to be proactive, not reactive, right? So what are the sustainability points that's into your DNA of your organization? So with that, I would say too, leadership succession. I, leadership, I had this rule even when I was in corporate. Like, I'm working my way out of a job, right? Who's gonna come behind me, right? Because I received a lot of promotions, so I knew I am going to keep moving. So I want to make sure whose role am I taking? How are they clearing the way for me? And then as I move up, how am I making it better for them to come along, right? It goes both ways. So thinking about that even from a leadership perspective too, of how is leadership, what is the succession plans, what are the growth plans, how do we keep people to stay in, because turnovers are very high when you think about staffing and the work we do. Trauma fatigue is real, compassion fatigue is real, right? So that's one of the things you should be able to do, is build that into as you're thinking about it. All right. So based off of the 5 phases we discussed, we're kind of thinking through, we were a team with breakout activities, but I don't think we're going to have opportunity to do that. So based on those 5 phases, if you could drop in a chat, which one do you feel like you want to work on for your organization, and what immediate benefit do you see by implementing it? So from a foundation building, like we probably need to spend some more time building foundations, building up like the needs assessment with the partners, stakeholder mappings. Here's all of that, right? We need to actually just work on piloting an idea. We know the foundation, we know the who's. We need to pilot and test and see what we can do with the idea we have. Or do we need to work on feedback loop? We need to build this into the integration. We kind of have those things. Which of the 5 phases do you feel you all are at in sustainability? Okay, work fatigue collaboration. All right. Okay. Seeing those come in. Got it. Yeah, no organizations, other organizations that can be involved with the youth. Okay. All right, this is good. This is good. I will also give you two. Perplexity.ai is again, it's an AI tool, but again, as organizations, a lot of these AI tools can help even in terms of like mapping out who's in the community. Perplexity.ai, you should be able to use that. Try to see if you're not sure who's in my community, just like what other youth organizations are in. Tell it to do like deep research. Um, like 47829 zip code, right? And be able to pick that list. Do one of the things I shared last week is kind of like do some undercover, do some undercover like pop ins and kind of do some calls, kind of test and see how that goes, right? And you can see if this is a good fit and just kind of get an assessment of what that looks like. And again, early conversations. And so our next poll is that as we talk about even implementation readiness, right? Where are you in your collaboration journey? Right? Are you just starting to explore? Have you already identified? Kind of in early stages, kind of want to check to see the pulse of that. Have established or looking to strengthen. All right, I'm seeing have established. Okay. Is seeing that one as the top one and then looking to strengthen. All right, good, good, good. I think even with looking to strengthen, because I see that's a strong second too, right? Even if you're looking to strengthen collaborations, I hope this is even helpful for you all to talk through. Like if you've already strengthened and you already have a relationship there, cool. Hey, can we do like a 2 day retreat? Can we do like a 2 day deep dive and everybody gets into conference rooms and you're able to talk through, hey, what are we seeing? Mapping those out, looking at those shared themes and patterns. How do we evolve this together, right? Everybody bringing that together within there. It's a tie on having established and strengthened. Okay, that's perfect. So starting to explore, you're able to kind of you see the work, but a lot of those that have established and looking to strengthen that, you already have that backing, which is great. But I would say now with that backing, look to how do we revisit what we've done, right? Pull the lens back. And we look at this framework and this model that we've gone through, webinar 1, webinar 2, like now we have this new information. How do we look through the lens of like use it as an assessment of have we done that? Did we do that? Do we pull here? Right? So we have those components as well. So now we're going to get into the integrated service model. And with that, thank you all for putting that in there. Moving from like how we make that work because integration isn't magic, but it's by design. I use by design intentionally because it is a very active work. Like using the playbooks, it works. We have to have the evidence-based models, but how you design that can look different. And true integration requires that precision. So SAMHSA has defined integration as systematic coordination with shared accountabilities and outcomes. Ooh, that A word. Our integration system, right, includes what that looks like. When you talk about coordination versus integration, right, it's together, right? Integration is making collaboration normal, not the exception. We work together. Working together is smarter and more efficient. Coordination is like making sure that we are able to be responsible for the outcomes in both of our spaces, but we're working less hard in some instances because we have the load shared. It's a shared load, right? So with that, right, when you look at how can that from a continuous model look like? So we have when we work with as well a community, a center of excellence that's in another part of the valley out here in Arizona, right? So there's a shared intake, right? That was a game changer where families have one comprehensive intake, right? And I have these blank stage 2, stage 3, like because it's going to look different because of the spaces and spheres you're in and the question marks. So we have one comprehensive assessment. So if you have that assessment, then based on that assessment, what are the different categories? Based if you think about like a drop down and a conditional branching, right? You have this assessment. You have, based on your audience, what are the categories they're going to probably need or they're going to share or disclose. Based off of that, then what triggers, oh, they need this type of provider. They need this type of service, right? And when you think about, once you go through even like the normal, not the normal, but you go through your, yeah, the normal legal process of even all of that aspect of like what can be shared, what can't be shared. But once you pass that, it's like, okay, once families tell their story once, all providers get is the information they need. Hey, right? If I have my target audience and I have one comprehensive assessment, what are all the things that they need? What are the different stages of that, right? What are the layers of support, right? What's the build down? What's the next stage? What's the build down? So if I'm talking to a team, if I'm talking to a parent that's intaking their team, they're already talking about, we're helping them from, we have a tiered system based off of what they're seeing from a behavioral, because we are trauma informed trauma care. However, from the level of, okay, no, based on these, you rank, you got to get you into a mental health provider, right? So we need to talk about that. If there's things that are happening even at home from free legal sources, or if, hey, they're behind on mortgage or rent, here's this resource, right? So based off of this comprehensive assessment, then we're going to say, all right, got this. We're going to give us a couple days. We're going to get back to you, right? We're already talking to them, but it's like, let's talk to our community partners. And so we're establishing expectations up front. We're establishing this is what it looks like up front. And then those partners are coming right on in like, yep, I've fully been briefed. I hear, if they choose to repeat, they can, but it's like now they can just jump on in. They already have a shared advantage to jump forward. So now we get into, again, we talk about the care planning, right? For those who already have established relationships, the round table, right? Majority of the time when you talk about even forging relationships, I saw it in the chat, there's the cringe factor of like, uh, like I don't, the fear of like, what does this look like? And again, the care planning, like if you can imagine every provider, from a counselor, a teacher, a doctor, a peer specialist, a insert here, are sitting at a table, you have that multidisciplinary approach, right? And then it's like from the family center planning across each one, you have the goal alignment, and it's building that consistent foundation of like, nope, we've all decided this is what this looks like when you come into the funnel, right? And then we have one of the things when you come to the table, you got to have the clear meeting agenda, especially when there's folks that don't want to meet. And there's people that's like, when it comes to time, you have to have that clear meeting agenda up front. And we talked about that in the webinar. We talked about the accountability structure. You can't deviate from it. And you can't, right? What are we going to look at? What are we're gonna get together? Yes, we're gonna catch up, have a networking, let's have coffee, let's have donuts, catch up on life. All right, now that we hit the buzzer, we're going right in. We're gonna talk about this data. We're gonna talk about these gaps. We're gonna talk about this, what's working, the success stories, what's the opportunity. It based on the opportunities, allow there to be shared problem solving amongst each of the providers that you're working with, and have the action plan, build from that. And so I'm curious if you can drop in the chat, from those that have established relationships and established partnerships looking to strengthen, have you all done that approach? Have you said, we're going to sit here at the table, we're going to dedicate a couple times, everybody from their spaces we're looking at, here's the data, here's what's working, here's what's not working, and then everybody is taking terms based off of their representation to creatively problem solve and innovate. Have you all done that to develop an action plan? Wraparound, yep. Okay. Yep. So I would definitely, okay, good to see. And I would say for meetings, this one would be a longer one. I say minimum of 2 days, because it requires that much focused time. And then minimum of 2 days to lay the foundation, and then have those weekly meetings or once a month meetings for the accountability to look back. We said we spent 2 days together and we said we were going to do these things and innovate these things. Now those monthly meetings are more strategic because we're looking to see that is making an impact, right? All right, cool. Thank you all for your feedback on that. And again, this is how you're moving from that separate case management to the shared responsibility. Everybody has a voice. Everybody has a voice now. Everybody. And I can guarantee you, when you talk about the burnout and the fatigue, some of that may go away because folks are now like recharged to be like, oh, my voice is mattering. We doing innovative stuff and some cool aspects. Like, how can you even look at reimagining what departments and what teams can help? Like, if we reimagine how just this department flows like this, but if they focused on this and can bring this to life, this literally has the impact to change dynamics even across even the organizations and how you all focus and flow to help from a conversion perspective as well. Um, and this is a recap from last week, right? The effective communication protocols. Even when you have those wraparound meetings, again, project management world, you call them stand-ups, right? We have the shared agreements, we have the regular communication. I'm booking all the calendar dates on your calendar from the time we say we're going to meet. Even if they change, it is there, the time is protected, and you can't say you didn't know about it. And the frequency and the formats. Like maybe it is a bi-quarterly where we do the 2 days because again, time is of the essence, but it's worth it. So maybe it's bi-quarterly that 2 days we're going to have those 2 days like deep think work, right? Deep dives. And then we have the documentation standards. So when we get to service delivery integration, another aspect that might happen, especially in the real estate market, I'm seeing a lot of it happen out here in Arizona. And I will say too, where because I'm a newer organization, I profit off of this, right? Co-location, co-locations, right? You can achieve similar results through mobile services and shared programming. Go to where the teams are. Go to where the partners, if you're like, hey, can I hang out at your office where they're there? Maybe from this time to this time. Cool. The school allows me to hang out there for a couple hours, right? I'm sitting in an office where they want to even talk outside of programming. I'm there. Our team is there, right? The therapy office, we're there. We have space when we have our families. We talked about that last webinar. We're able to we have, and I'm saying like I don't have keys to the school, but I have like keys with the mental health partnership that we've designed an MOU, we've designed an agreement that I'm also able to have space that helps co-location opportunities, right? That's the shared programming. Those are cross training, right? There's technology, removing a lot of when you're talking about money and cost. A lot of aspects is like if we didn't have a financial component, if you can't pay me, what are the things you can do that will help relieve the financial burden through this collaboration and this integration, right? So one of the other aspects, and that I will say too, is what's your technology stack? Sorry, something's in my eye. What's your technology stack, right? Technology also enables relationships. It doesn't replace them, right? I would there where you have to use paperwork, okay. But the more you can set up technology and set up shared dashboards and pretty reports where there's access, like where, of course, legal and compliance identify what tools are safe for your organizations. That's also affordable and customizable. Let me put that disclaimer there. But technology is like, if your boss is like, I don't know the way to that, and then you've all created this dashboard, like every week you can go look at this dashboard and they're like, oh, I'm seeing intakes have gone up. I'm seeing conversion coming over, right? I'm seeing the benefits because I just set up a dashboard that's set and forget it. Set and forget it. What's your technology stack? Are you using technology to go further faster? Are you using technology to communicate? Lucid Spark, right? That's a virtual whiteboard. Even if you can't get together in person, maybe you're on a Zoom like this for an hour quarterly, and here's our shared outputs with some sticky notes. That is there, that can be captured, that can be used as an artifact for later, right? Be able to look at that to help even strengthen. I would say for okay, so for those that again, strength, you are good. You're like, hey, we're looking to strengthen existing relationships. We have consistent relationships. Can you drop in the chat, are you all using technology? What are you using for those that are looking to get into this realm? And even those that may be like, oh, I didn't even think about that. If you can drop your technology stack in the chat, if you're using it to help even your partnership collaborations go further faster. Um, and I'll go ahead and see there. All right. Oh, da 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 da. Must add. Many case managers are burnt out because many institutions are not employee centered. It's about meeting numbers for the grant. So asking them to do additional work may be unrealistic. Right. Okay, that's a good call out. So based off of that, if it's also a nonprofit perspective, you can see if there's volunteers that you're able to do. And again, paint the picture, paint the challenges. Here's the situation. Here's the current context. Here's the challenges and what we're going to face if we don't get help here. And then paint the success story if we bring in like a volunteer, if we develop an intern program for the summer as well. Here's what we can help do with that to kind of get around with that one. I'm definitely I I had the greatest part before I left corporate America. One of the companies, Rocket Mortgage, was for sure a human center, and I was so happy to see the evolution of that. And so many that is a again a lot of, if you're gonna be human experience or human centered for your audience, it helps to be human centered in your organization in the DNA. So there are things that can be done, but that's going to be a longer webinar. And then having your role let others, somebody else's role instead of trying to do it all. Exactly. That's where they'll clear communication. And we talked about that in the last webinar too. Roles and responsibilities, map them out, right? Basecamp. I don't know if you all know, but nonprofit, Monday.com is free for nonprofits, right? There's a lot of things you can do, very customizable. Look into that as well. Okay, so measurement and accountability, right? Accountability. Everyone that I talk to like laughs when I do that. I'm like, ooh, the A word, because accountability isn't about blame. It's really about improvement. It's basically making sure you're doing what you say you're going to do in that, right? And when partners know up front, the accountability is also posted, the accountability that is also going to be revisited and reshared. It also impacts it shows like it builds trust, and then it also shows like we get to have collective problem solving because we keep looking at it and we keep bringing it up, right? And it's not based on individual performance and evaluation. Okay, pre and post, like again, my measurement accountability that I share with the schools, my pre, my middle, my post board report outs. We said we are going to do this. This is what is being done. This is what we're seeing in attendance. This is what we're seeing in outputs. This is what we're even seeing in behavioral, right? So it builds that trust even more. And so you want to measure what matters, right? Measure what's moving the needle, whether that is a process, whether that's your activities and the outputs, right? The outcomes, the system measures, and satisfaction reports, right? And again, this isn't new to any of you because you're all like looking at data every week from what I saw there. But it's like if we are evolving what we're looking at, if we're evolving the way we're doing it, then what does that look like? If there, what are the new metrics? What are the new process? What are the new outcomes? What are the new systems, right? Yes, we're looking at it this way, but maybe there's a new way. Again, looking at today's generation, how do we look at new measures? And we can't change it all overnight. Again, starting small. So if we're going to take one component to measure it, then that's how we're gonna. That's the one we're gonna do. Let's see how fast we can improve our response time, right? Let's record whether youth are staying engaged, and if they're not staying engaged, where are they dropping off at, right? Where are they dropping off at? What are our partnership collaboration rates, right? For those that are, and if they're long, so for those that are, I have established partnerships, I've been in this, we're locked in. How long have you been locked in, and have you seen innovation from them? Ooh, have you seen innovation from them? Have you seen changes from them? Right? And what are families saying about the experiences? Those are the aspects that matters. So if you could drop in the chat, right? What do you see? How do you please share how you measure what matters when it comes to youth and families? We'll talk on that very quickly. You just drop that in there. And then as you're dropping that in there, I'll go to the technology for measurement. So again, we talked about, and I see there's a generational divide regarding use of technology based on leadership. You know, yeah, I get that. I get that. And it's one of those where literally you just have to keep pulling along, and pulling along. I never thought I would see the day that the Jetsons would be in real life. A lot of those, and see, I don't know who remembers the Jetsons. I'm so dated myself, but you just have to keep pulling along and keep showing, right? And again, technology for measurements, having those databases, having those tracking systems like Microsoft Forms, Google Forms, having those outputs of like, okay, Tableau, using those to create the things that you want to see, business analytics, right? Even having those automated reporting, like the technology works, right? The surveys, yep, registration, yep. I'm seeing that in there. That's awesome. And so now we get to the action planning. Again, I told you information without application is just information. So one of the ways we help organizations is the approaches of like, again, 30, 60, 90-day framework. To me, it has never gone wrong. It's just never gone wrong. And you want to start with what are those quick wins in the 30 days. I know it's not, this isn't great like work that was like, we did it. And it's going to take a little time, but what are the quick wins within 30 days? What are the quick things that we can do? Even if it's like one for us was like, we can have just one ally in the community, right? That's gonna vouch for us, right? For then 30 days, that will be able to see the value we bring, to see the trust, to see what we're doing, and that's gonna be our mouth. That's gonna be our mobile billboard, right? That is aspect, right? That's one component of it within 60 days. Like, well, maybe it's like I did a virtual coffee. I was able to connect to X partner, or at least built my list out, right? What do you think within 30 days? And then continue to build upon that. And some of the implementation recommendations that I'll have is like, really, when it comes to this program and reevaluating, if you look at your, okay, I'm not alone with the Jetsons. I'm not alone. When you look at implementation component, right? Just start. Sometimes we have these ideas and maybe it's not a big scale of it, but it's like based on the assessment of the current resources you have, the partnership readiness, and the pilot program design. Like, how can we just start? How can we just start to move the needle, right? How can we build the buy-in? How can we build the trust, right? What are those leadership engagement strategies? What is the staff training? What's the support look like? What is the awareness campaigns, right? What are the early wins we can communicate and implementing over the next 30, 60, 90? And then, of course, change management. Change management is huge because we want to be able to have that. All right, this might come up. Let me problem solve. If we think about the barriers that we're going to get to ahead of time, then we can pivot, right? We can have the continuous feedback loops. What are the things that we need to bring people along with? And then sustaining momentum. When we talk about keep the momentum going, right? Like, you want to be able to have a culture of regularly celebrating success, regularly celebrating, so it's embedded into the DNA. Ongoing development, but ongoing development as it pertains to what we're trying to build for these programs, for these youth, right? How are we seeing us get better? How are we seeing the people get better? How are we seeing that our teams are improving for the youth? What are the new things, like who's on your team telling you what's happening with the teams today and how you can translate what that is to that, right? To their language, to how they'll come in, how they will stay. What does that look like? And then what does even partnership renewal processes look like? Just because you've been with them a long period of time, then, right, are they still a good fit? Do we have a criteria that's even built up for that? And then having those innovation cycles embedded in, right? I don't think we have time for number three, but this is the 30, 60, 90 day, right? This is the 30, 60, 90 day. And I want you to actually, this is your homework. Yeah, I'm glad for this. This is your homework because everybody's going to copy of this. Hopefully, I see you on part three. That is going to be on June 11th. Next week, I will not see you because we have gone over a lot. And again, for those that have existing, those that are new, use this time, protect this time next week. Act like we're still meeting and use that as think time, right? Use that as I'm gonna go into the conference room and I'm gonna work on this 30, 60, 90 day plan, even if I can. I'm gonna watch the webinar and kind of like pause it and go back and do these notes. Because a lot of times, and again, I told you my background, I've been on a lot of trainings and webinars. And if I don't take the time to plan in actually taking the learnings, taking the content and digesting it and writing it to the spaces that I'm in, it's just going to be just another one that like go over not good information, noted, and moving right along. But let's truly move the needle because it's a matter of life and death with these kids, with these youth, if we don't get them the resources that they need. So I hope you've had enough time to kind of like look at this third interactive slide. But again, it's key takeaways: having that systematic design, having that phased implementation, continuous improvement, and above all, keep the youth and families needs. So I haven't seen any Q&A drop in. I know last week, I hope I did better for those that's on here the second time from a pace and slow down. I know I got that feedback last week, like slow it down. So we weren't right crammed at the end. So we are not rightly crammed at the end. So thank you for joining. Thank you all for joining. I appreciate you all. The next section again is June 11th. You are going to get this emailed. And again, here's my contact information if you have questions later after you're thinking about it. I know next Wednesday, if you're working through this, this is my LinkedIn, my email. If you want to connect, I definitely hope, yes, you will get a recording from this week. If you registered for this webinar, they are going to send it to you. And I'm so glad. Thank you. It was great the second time. I'm great to hear. Thank you for that fast feedback. I'm glad to hear that. Glad to hear that. And I'm going to be looking at the survey results this week to make sure if there's any changes that I need to make for our final session. But I definitely hope that you all take this back to your spaces. I love it. I love it. I love it. I love it. Appreciate you all. Yay.
Thank you so much, Tiffany. Please continue to give her some love in the chat. Really appreciate your time. This is part 2 of 3. As she said, our final series session will be on June 11th. And really, again, just to double click on her recommendation to keep this time, the same time, same bat station next week on Wednesday to develop your 30, 60, 90 day plan. And then we will catch up again for our final section on June 11th. Please take a moment to complete the survey. As Tiffany noted, we read those, she reads them, we read them in intact, and this helps support our ongoing work to make sure we have high quality presentations and trainings that really meet the needs of you and your community and your team. So please know we are here to continue to support you. Yes, you will get slides. And really appreciate your time today and hope you all have a great rest of the week. Thank you so much.